Omaha did not have a Department of Physical Medicine and Rehabilitation before I came here. And so part of the opportunity was to develop and start a new department.
We're lucky in the fact that we have a categorical program, so we're associated with the Nebraska Medicine during our intern year, and that's very helpful coming into our second and third year.
The program excels at being able to offer patient opportunities, patient exposures.
We're focused on the quality of life of patients after they've had a life-altering event.
Omaha is a great place to live, and it's a great place for families. It's a great place for young adults also. There's lots of things that are happening downtown, lots of great places to eat.
We specialize in neuro rehabilitation at Madonna, and we have many patients with complex medical and neurological problems.
You could come here and you have a TBI unit, and there's 16 beds for your TBI unit, there's 16 beds for your stroke unit, and there's 18 beds for your spinal cord injury unit, and there's 16 beds for the cancer unit or the general rehab unit. And so the volume of patients we see here far exceeds many other places that I interviewed at.
That repetition is really what helps residents in their training become more comfortable in caring for these patients.
Generally our day starts around 8. We come in, we'll just chart check our patients, look at vitals and labs for the day, and we'll go around for a little bit with our attendings.
You're going to spend most of the day either in the hospital or in clinics. Usually that's until at least 5 o'clock. If you get a break throughout the day, you usually try to take advantage of catching up on some case logs or some studying or getting prepared for lectures that are on Fridays.
We collaborate a lot with the rehab team in general. There's a lot of members involved with that, from the therapists to the nursing staff to the physicians and residents.
Dr. Weaver is an extremely detail-oriented individual who also is very laid back and welcoming in his teaching.
Willing to teach you, willing to answer any of your questions, and they care about you as a person, which I think is very important.
The rehabilitation facilities are some of the best in the country in terms of the technology that we have available to use with our patients.
A 5,000 square foot therapy gym that they can see these patients involved in their individualized plans with the therapists.
I have learned so much from the therapists here. They're some of the best that I've seen. I can just go into the therapy gym and talk to one of the therapists and learn more in that 30 minutes than I could reading a textbook.
So we're really excited to have the new Madonna Physicians Clinic because it will give us 8 exam rooms that we can utilize for both residents and faculty to provide clinical care as well as teach important parts of the residency program such as EMG training and ultrasound training. This will give us an opportunity to train our residents the way we want to, and will give us the opportunity to work with them one-on-one.
Rehab Institute through Madonna, we do work with Dr. Burnfield doing some research, so we most definitely have plenty of opportunities to be exposed to research, ongoing research projects. I think I've learned how to become a good physiatrist. I think I've got a well-rounded education that I really at this point would feel comfortable going into any inpatient setting that I would be interested in and being comfortable in managing patients, whether it's from medical management to rehab management.
The supportive environment that you get with this program. That I'm very good friends with my co-residents. I know their families, I've hung out with them outside of work.
Most definitely have a good culture that's starting to build, very friendly, cordial culture that we have.